As Nigerians head out to primary healthcare centers and other facilities to get their second COVID-19 jabs, concerns persist over when the next batch of vaccines will arrive in the country. Such fears have been compounded by the fact that 4 million AstraZeneca doses, which Nigeria received from the COVAX alliance 3 months ago, are only sufficient to vaccinate just 2% of the population. The World Health Organization, on the other hand, has recommended that countries would need to vaccinate at least 70% of their citizens to achieve herd immunity. What is worse is that several months after the federal government said it would submit a supplementary budget for the procurement of COVID vaccines, no bill has been presented to the legislature in this regard. With so much uncertainty beclouding Nigeria's vaccination campaign, we have with us Dr. Rukevwe Ugumba, a Canadian-based associate professor and family health specialist. She'll be talking to us on ways Nigeria and other African countries can roll out robust vaccine programs. Good morning, Dr. Ugumba, and welcome to the show.
Hello, Tindu. Hello, everyone. Nice to see you all again.
Same here.
Dr. Ugumba, good to see you again. Well, very quickly, Nigeria has taken some steps in recent times. The government is rolling out the second phase. Second, we've been told that negotiations are ongoing to get the next round of vaccine doses between July and September. And government also recently has published twice a list of persons who ignored guidelines, regulations with regard to persons coming from high-risk countries in a naming and shaming manner. What's your assessment of some of these steps, and how confident can we be that indeed by July, September, the government of Nigeria will be able to get the next round of vaccine doses without necessarily relying on the COVAX scheme?
Hello, everyone. First of all, we have little disagreements, so I would like to say to Rafai, yes, it was 400,000 cases. And right now, I think there's more than, you said it was 174,000 deaths at that time. And indeed, in India, and we know that probably I was mixing up the cases and the number of deaths. Anyways, going to what was happening, I think our last interview here was very critical because just shortly after, like you said, they were naming and shaming people for compliance to the travel advisory. And that was very exciting to me to see that for sure, for once, government is actually taking action and they published a whole list of names of people. So that was a good step forward. So people knew that when they were traveling to high-risk countries, they wouldn't just come back and spread the virus, even though they felt fine. Now, what are we doing? I was happy when they talked about a supplementary budget, but as you have rightly noted, nothing has been passed. And no further income has been gotten. And we knew right from the last time that they said they were going to get Pfizer in Nigeria, and we're excited about that. Again, we haven't seen any Pfizer vaccines. And we know that because of the Indian cases, vaccines were divided there, and so we couldn't get vaccines in Nigeria. So the vaccine supply is actually dwindling in Africa. So what to do about that? First of all, why are we waiting? Why are we waiting for vaccine manufacturers to import vaccines? Just yesterday, Pakistan did a PACVac, which they did in collaboration with China. So China shipped to them the Sinovac in bulk, they say concentrated form, and they reconstituted it to their own needs so that they will have more vaccines available for Pakistanis. So why aren't we doing that in Nigeria in collaboration with China or Germany or United States or whoever? Are we telling ourselves that we're not capable of reconstituting vaccines, even if we did not manufacture them? What is really wrong with our systems? Because we know we have the science, we know we have the people, we know we have the labs. Fortunately, I was an advisor, a consultant to the Senate Committee on Health from 2015 to 2019. And I know how much was created for new labs, for NAFDAC, and some labs were built, and part of the labs were for testing, regulatory, and even for development of new drugs. So why are we not using these labs, and why can we not upscale the capacity? So I'm very I'm very a bit upset that Nigeria is not in front of this. I know there was a regulation passed just last week in Addis Ababa where they said that Africa was really suffering. And in fact, the resolution said that Africa should develop more in terms of manufacturing. And this was especially in respect to the COVID-19 vaccines. And so they said, you know what, this resolution, because over 90% of the world deaths are for malaria and even HIV are in Africa, and now we haven't really caught on with the COVID, we don't have to wait for that. We need to get into manufacturing of vaccines and drugs. And I think that this is where they need to step up. If the NAFTA can't handle it, they should make a new special agency just for this. We can't wait for COVID to come. I'm still happy with our numbers, at least officially. We're just about over 2,000 deaths and less than 400,000 cases. But this is what made India comfortable, that there was no COVID pandemic in India, and we know what happened subsequently. And we know that how we stopped Ebola was by importing. So we stopped it at the border because we had stringent measures at the border. We're checking temperatures and doing things like that. Again, we have relaxed. I just flew from Asaba to Lagos, and they didn't check my temperature when I landed in Asaba. Neither was there even hand sanitizers to meet and greet me, as I once had. And nobody enforced the mask use. Some people just had the mask on board, and when they came down, they had no mask. So we are really joking with this, in terms of enforcement. Even the government agencies have relaxed, is what I'm saying. At the airport, I didn't see any measures taken to ensure that people are doing the basic things since we don't have the vaccination. I mean, less than 2% of Nigeria population have been vaccinated with 1 dose. Much less 2 doses, and we know what we need to start relaxing is about at least 20% of the population. And even now in Canada, and Ruben would say, oh, you love talking about Canada, but the truth is we had severe lockdowns until just yesterday, and they said schools cannot open until the fall. So in September, that's when schools reopen to in-person learning. These are measures taken despite the fact that we have so many millions of Canadians vaccinated with 2 vaccines. So what do we do? Nigeria, please get into manufacturing of vaccines. Pakistan is not more superior to us. They have rolled out their own PACVac vaccine. I'm looking for the NIGVAC vaccine. Partner with someone, let them bring vaccines to Nigeria.
That's an important challenge there, Dr. Ugumba. But I want to talk about countries like Canada, who have been guilty of hoarding vaccines. 85% of the vaccines that have been administered have gone to wealthy countries. So it's a shameful hoarding, sitting on vaccines that their whole population does not need, whereas they're badly needed in Africa. Are we going to wait until more and more COVID variants come out? We had the Indian variant named Delta. Are we going to wait till there's an Omega variant and, half the world has been infected? What is the kind of blame that you assign to those wealthy countries, and what would you like to see them do?
Well, what can I tell you? We don't want to die anywhere. The truth is, I'm a little bit disappointed, and Ruben will be happy about this, with Canada for not manufacturing its own vaccine. We were buying vaccines just like Nigeria. Unfortunately for Nigeria, I don't think we paid for the vaccines. And right now we have a lot of wastage with the AstraZeneca vaccines, which we purchased in Canada because we're not using it. And I don't know how they can redirect that to countries like Nigeria. The truth is, I don't have the powers to say to the World Health Organization to say, look at this, and look at that. It's really not good enough that Africa and the poorer nations do not have the same access than wealthy countries like Canada have. And like I said, we didn't manufacture our own vaccines, which is something that Trudeau has the answer to. But we have the vaccines that we're buying. We have Moderna, we have AstraZeneca, we did have AstraZeneca, which you're not using, and we have the Pfizer vaccine. And the Johnson & Johnson, I think, is still going under approval. We haven't had that approved yet. What can we do? I'm saying to Nigeria, partner with China. Any virus, any antiviral vaccine is better than water. And we know the pandemic started in Wuhan, China, and right now China is operating business as usual. So I know that they have an effective vaccine. And we know that even the AstraZeneca that caused some side effects was still effective against the COVID-19 virus. So I'm saying to Nigeria to do something about it. Don't be putting your hands in the air and say, oh, me again, or this and that. We actually have money to prevent deaths. Like I said, we're very fortunate as yet that we're getting 200 cases a day, which is really low. And like I said, how do we believe that these are true cases? Because of the numbers of testing. Testing is not being done. The follow-up is not there. Like I said, I still didn't get a text since I arrived in the country over 2 weeks ago. Whereas we know that they should have followed me, although I did comply, but there was no enforcement for me, even though Canada is a low-risk country. Still, everyone coming into Canada must test at the airport, will be quarantined for 14 days. After you test negative before you leave the hotel, by the way, and then you will now quarantine for an extra number of days just in case you carried it along the way. So Nigeria needs to do something more like that. About our vaccines, let's manufacture. Let's partner with people, give us concentrated vaccine, let's reconstitute them and distribute to Nigerians.
Well, Dr. Ugumba, thank you. I hope the authorities are listening to you, but just by way of information, Dr. Fisai Shuaib of the Primary Healthcare Development Agency only this week said that, in fact, part of the plan is to fast-track local vaccine production. I hope they will get round to it and that they will take on board some of your suggestions. Thank you very much indeed.